You. Should I go ahead and start over? All right, we'll get started and hopefully catch people up. So thank you all for coming. I don't think I've met everybody yet. My name is Debbie Napolitano, and I'm a licensed behavior analyst, and I'm also faculty at Damon University. I wear a few hats like a lot of people do. And have been asked by Seamus's family to work with him and to work with you guys to see if I can be helpful. I know that he's had times of struggle, and it's one of the things that hopefully that I can do is to be a help. And so there's some things that we think might be important to just really sort of start with to help understand a little bit about Seamus and why he does some of the things that he does. When I do this kind of training, it's really important to me that it's interactive, that you guys ask questions, tell me if I got something wrong. Just really, because this is about if I can be helpful, and we'll find out if I can be, but if I can be helpful, that's what this is about. So, if it's helpful to know, I was direct support professional for many years. And so I really try very hard to think about all of this from that perspective whenever I'm working with somebody. I had a lot of things that I learned over time before I went back to school because I figured out that this was something that I really wanted to do with my career. So I do have some understanding, but everybody's unique and everybody's history is unique and every person we work with is unique. So there's that. So what I've done so far is just tried to get to know Seamus. I've learned a little bit about him from his records. So are you guys familiar with the fact that he went to a place called Kennedy Krieger Institute before he was here? Or while he was here, actually, I think he was already living here and then he went. Kennedy Krieger Institute was it before? So it was a while ago though. I can't remember the date. Kennedy Krieger Institute is a place in Maryland. It's at Johns Hopkins, the hospital Johns Hopkins, and it is probably the most skilled setting in the world for working with individuals who really struggle, like Seamus struggles with behavioral issues. When somebody, particularly somebody from New York, because I've been doing this for a long time, including in New York, and when somebody from New York goes to Kennedy Krieger, most often it's because they've really struggled in their typical environment and they need that level of, it's a hospitalization. You live there in a hospital setting, usually for a good 6 months. And during that time, people assess your behavior. They look at everything. They look at the medications. They try interventions in a place where it's safe to try some of these interventions. And then the person's discharged. And sometimes the most difficult part of the whole thing is coming back to the environment where they were before and transitioning back to a typical environment. So if you looked at the plans that Seamus came back with from Kennedy Krieger, which I spent a lot of time reading them, they're pretty complicated. And they require a lot of work to implement. But they were effective. And so part of what we're going to try to do with this training, first to try and understand why Seamus struggles in the ways that he does, but then also to start with a very simple baseline intervention is all based on the work that they did at Kennedy Krieger. It's like they spent all that time and hundreds of thousands of dollars to do this work. And we're going to just really look at it from the perspective of, this is something that worked for Seamus. So let's figure out if there's ways we can help him be successful from what we've learned from Kennedy Krieger. So that's really kind of what we're doing today. And I always sort of think about it as if the state made an investment of like hundreds of thousands of dollars, we probably do owe it to somebody to try and and make sure that we're using what we learned. So that's sort of the focus. And when I say the ABCs of rigid and repetitive behavior for this training, it's really combining a couple of things. One thing is that I think you'll learn through this training that I think about everything through what I call ABCs, antecedents, behaviors, consequences, and we'll talk about those. Have you guys heard those terms before? We'll talk about those. So that you'll literally see how my brain works when we go through this training. And and I combined it with rigid and repetitive behavior because that's one of the core features of autism, and that is from my time I've spent with you guys and with Seamus and reading his history and everything from Kenny Krieger. My best interpretation of what's going on right now is that he's really struggling because of that core feature of autism that he really probably can't help, is that rigid and repetitive behavior. So what I mean by that is him making sure that everybody says back to him exactly what he wants to hear without veering from it, right? Like I've tried when Jeremy is there, I was able to give him a different response, but like if he says going on a plane, I was able to say, "Oh, are you going to get there by to the airport?" When Jeremy was there, because he has such a long history with Jeremy, and he was fine with me. But when Jeremy's not there, and he says that to me, and he says say it, and and if I don't say it, it takes about a second to see him start to get, sort of like, because there's something about that, and we'll talk about that. There's something about hearing that's really important to him, that we don't really understand always, but we'll talk about that. So anyway, that's what I mean by rigid and repetitive behavior. Okay. No, why? Okay. So when I as a behavior analyst, when I think about behavior, I try to think about it from the perspective that all behavior serves some purpose or function. And by behavior, I'm not just talking about problem behavior, like things that people might do to hit, or I'm talking about picking up my cup and taking a drink. That's the behavior. The purpose is that I like the way it tastes, so I pick it up and I taste it, right? So it all serves a purpose or a function. We've learned over time, think about how we're raised. We've learned over time how to behave, and because of the consequences or the reasons, the things that help us be successful. And really, this is all based in child development. So at certain areas of our child development, we may be doing different things. But when we're talking about, I'm going to call it interfering behavior, because the way I think about it is this interferes with somebody having a successful, good quality of life, that it may be often related to difficulties with communicating. So when I think about Seamus, he may not be able to say, it's going to really feel bad if I don't hear exactly what I need to hear. But he's just going to keep telling you to say what he wants to say. He's not communicating how he's feeling. He's not communicating what he's thinking. He is just basically telling you what he wants you to do. So the other thing about behavior is that we all have what I consider a frustration tolerance level. And this comes into play, and it's really important to think about this from the perspective that we all have bad days. So there are days, or even sometimes weeks, that Seamus may struggle more than others. And from that perspective, the question always becomes, what is going on that's making his tolerance of things even lower? So I think about tolerance of things for myself when I'm having a bad day. So I haven't had enough sleep. Well, I don't never have enough sleep, but if I haven't had at least a decent amount of sleep and I'm really exhausted, and somebody comes to me with something that I find annoying, that happened this morning in a meeting, I was like, I was not tolerating it well, and my behavior showed it. I was really struggling with how I was responding because I was becoming easily frustrated. We see that with ourselves when we're working with anybody, including Seamus, and we see that with Seamus when he has periods of time that he's struggling. And so we have to be especially diligent during those times to make sure that we are following whatever plans that we're following, that we need to follow. So when I think about where do we begin, the first thing I like to think about is, and I'm going to focus on you three, and I apologize, but because this to me is really important, at having been there. If I ask you what is the main purpose of your job, or the main function of your job, what would you say it is?
To support and assist.
To support and assist?
Make sure they're getting out more, like, out to the environment that they're in.
Quality of life kinds of things, yeah. Anything else?
Make sure that someone's needs are being met
Mhm.
properly as well.
All of those are true. All of those are true. The other thing that I think about that I love when I hear, and I don't hear it a lot because it's not commonly communicated, is also that you guys are, in many cases, are teachers. That's the way I think about your role is teachers, that you're spending, how much time are you working with somebody and you're modeling, you're helping them, that's where some of the support and assist comes from, right? It's you're modeling what to do out in the community, you're helping them, supporting them, helping them be safe, but also learning things. And so from the perspective of trying to figure out why somebody is struggling, it's not so much about getting rid of the behavior. It's often more about figuring out how we can teach them other ways to be successful. And so what we're going to do through this whole training is talk about the why of behavior. So one of the things that I know all too well is that if we don't understand why behavior is happening, then our intervention is going to be based on best guess. And I think about it from the perspective of, if you go to the doctor and a doctor said, okay, those symptoms, yeah, I think I'm going to prescribe this med and this med. We're probably going to be like, wait a minute. You didn't ask me any important questions. You don't really know what's going on here. Do I need some tests, whatever? It's the same kind of thing. If we're just coming up with interventions without really understanding why the behavior is happening, we're guessing. And guessing sometimes can sometimes actually make things worse because we could be trying things that are actually making things worse rather than better. It doesn't guarantee that we're going to be successful if we know why the behavior is occurring, but it gives us a better chance. So that's a big part of what we're doing here, is trying to figure out why, or trying to talk about and problem solve why Seamus is engaging in some of these behaviors. And that then leads us to how to help solve them. And again, I'm just going to come back to this one more time. Because of the difficulty with expressing oneself, that's a core feature of autism. No matter how well a person can speak, if they're diagnosed with autism, they struggle with communication in some way. And if you think about Seamus, when we try to think about the purpose of those repeated statements, he's communicating something to us. We don't always know what he's communicating. And sometimes sometimes it's fun, sometimes it's adorable, sometimes it's, it's a whole bunch of things, but we don't know really why. We don't know what he's trying to tell us. Is he just simply trying to interact with us and it's the only way he knows how? We don't know. And that is not uncommon for autism. So one of the premises we're going to make here is that basically we know that what's happening in the environment plays a big role in behavior change. And any change that we want to make with Seamus, any change with anybody, with ourselves, with whomever, takes time. It takes a lot of time to change the environment around us. And we know that it's very easy to fall back on past behavior. I don't know about you guys, but I've tried behavior change for myself a lot, and it's easy to fall back on past behavior. We also know, and here comes these words again, that what happens before the behavior, the antecedent, and what happens after the behavior, the consequence, makes a big difference in when and why behavior occurs. So when you guys hear the word consequence, what does that make you think?
Not trouble, but like,
A reaction to your action.
A reaction to your action, that's good.
I don't know how to put it. Cause it's not like a trouble, cause consequences don't mean like you get like, in trouble. It's like some type of. I don't know how to put the word.
That's okay. I think you guys are already ahead of the game here with that, because consequence for me, when I use the word consequence, all it means is the behavior is what happens right after the behavior. That's all it means to me. It doesn't mean good, bad, whatever. It just means what happens before the behavior and what happens after the behavior are the things that we pay attention to when we're trying to figure out what's going on, because patterns of behavior tell us how to figure out why a person is doing what they're doing. And so the other thing that's really important to keep in mind is that I can't tell you how many times I'll be working, I'm not here, how many times I'll be working with somebody or a team, or I'll be in a school and they'll say, well, they need consequences. And of course they need something to happen that's negative, right? And what we know about human behavior, what from years of research, is that behavior responds much better to positive consequences than it does to negative consequences. If you are living in a place where you are not comfortable because people are responding in a negative way, your behavior is going to reflect that. You're not going to want to be there, right? So positive consequences make a huge difference when we're thinking about behavior. This is just saying the same thing in a different visual. That really again, think about it. The environment plays a big role. It's not only the environment, and when I say environment, I mean what everybody in your environment does, what everybody says, what people do. Um, because we all have histories too that we're bringing to the table. And so that plays a big role as well. But what we're focusing on right now is just what happens in the environment. So what this is called and what we're getting into now is called function-based thinking. Has anybody ever heard of a functional assessment? So within OPWDD and within schools, there are really clear regulations on conducting functional behavior assessments. And functional behavior assessments are essentially what you do to figure out the why of behavior. And so if you're working with somebody who's struggling, a functional behavior assessment should be conducted. And that's looking at the antecedents and the consequences and figuring out the reasons why the behavior is occurring. It's bigger than that, but for the sake of today, that's what we'll focus on. The thing about Seamus is that he went to Kennedy Krieger, where they do way more than just what we call an assessment. They do a whole analysis. They do all kinds of testing, behavioral testing, that kind of thing. So we have some really good data to work from with Seamus with this function-based thinking. So we're ahead of the game there. But again, this comes back to what happens before the behavior and what happens as a result of the behavior. So what happens before a behavior is really important because it gives the person the cue that the behavior can happen. So when I'm working with somebody, one of the first questions I ask the people who are supporting them, if I want to see the behavior that you're concerned about, what would I do? If I wanted to make it happen, what would I do?
Do something to encourage it or trigger it.
Yeah.
Yeah.
How would so with Seamus, how would I
Not repeating what he asked.
not repeating not that and what else? Is there anything else? Because I know I'm focusing on that.
Taking food from him.
Taking food from him, okay? So taking food. So if I wanted to see Seamus, which I don't, but if I wanted to see Seamus engage in one of these behaviors, actually, I take that back. some of the problem with being a behavior analyst is when I don't see the behavior, it's harder for me to help. But I have to do the best I can to sort of rely on report. But I don't want anybody to have to, and I don't want Seamus to have a bad day either. So that said, if I wanted to see Seamus engage in a really difficult behavior, I would not repeat what he says. If he's demanding, and he's demanding that I repeat him. I mean, that's what, if I delay, which I have done several times, and then after a minute or so, I do repeat him because I don't want you guys to have to experience that. I don't want Seamus to have to experience that. So I'm giving him what he wants too. I know that is going to increase the likelihood that he is going to engage in a behavior, because I can almost see it. Like, I mean, can you guys am I I could watch him, like, the minute I don't say back and he starts to get
Overexcited.
Yes, exactly. Like it is so clear to me. So I don't have to take him to Kennedy Krieger to figure that out, right? Like, I can figure that out being in his apartment.
Right.
So that helps us a ton, because can we fix that? Maybe. I hope so. But are we going to fix it right away? Probably not, because it's going to take time. Now, the other thing that we know is that the consequence, what happens as a result of the behavior, is what keeps it going in the future. So let's say in a perfect world, not repeating Seamus when he wants you to repeat him. Let's say he wouldn't tear the house apart, right? Let's say not repeating when he wants you to repeat him. What would happen with him, do you think would happen with him asking those questions repeatedly?
Yeah, I understand.
He will. Let's say it doesn't agitate him. Will he keep doing it? Do you think he'll keep?
Yes.
For how long? Do you think
Eventually it will stop.
Eventually he would stop?
Yeah.
Eventually. So this is a long-standing behavior. And the longer a behavior's been reinforced like this, the longer it's going to take to fix. Think about any behavior that you do that has been long-standing. It takes a long time to change. A long time. The most effective way, and we'll talk about what extinction is probably to stop repeating him. But are we going to do that? Is that safe? No, right? We're not going to just stop repeating him. The problem is that what sometimes probably happens is that somebody's busy. They don't repeat him right away. And then we see the escalation. So in real life, it's not feasible to keep this up, because in the real world, you can't keep up the pace of the repeating that he wants you to keep up. It's just not feasible to keep doing that. So from that perspective, the consequence here, or what happens after the behavior, is he gets to hear something that is very important to him. Why is it important? I have no clue. Something internally. I hypothesize, and I have no way to know this, that if he doesn't hear it, it's almost physically painful for him. That there is something internally for him that, because of, and this is related to having autism. It's one of the core features, this rigid and repetitive behavior. It's the way his brain works. There is something that is so important to him about hearing that he is willing to engage in some of those behaviors, and in order to get you to say it. And we'll talk about the eggshell effect, because that's what it creates, right? Like a feeling of walking on eggshells all the time. Because if you don't do it, then he's going to start to escalate. If you do it, is that really the right thing? So we'll talk about that eggshell kind of effect.
I know to him, and I had worked with him last week. It was Thursday, and it was big, and I think I put the wrong sheet, not the sheet, but the
Comforter.
He snatched it off, but he did it himself. I didn't know where his normal comforter was.
Uh-huh.
He set it up, and I seen the cover on the side. I said, "You didn't want that cover?" He said, "No." So I said, "Can you hand me the cover?" He handed me the cover, and I pulled him back over my pillow. So I will say,
That's great.
yeah, I do walk on eggshells because I don't know more like that.
Right.
So,
Yeah, and he has a reputation, right? So the thing I want to say there though is that you listened to him. Him taking that off the bed, that was him telling you he doesn't like it, and you honored that. And I think that that's really important. What we would rather, right, is for Seamus to be at the point where he could say, no, that's not what I want, right? And then you could talk to him and figure out what he does want. But in the absence of being able to do that, and we may or may not ever be able to do that with Seamus.
And sometimes he does say like blanket all done. He'll say like some to
You
that.
have some of that.
Yeah, it's either blanket all down or he'll just say help. Well, for me, he'll say help. But now I got to the point where like I'll grab both blankets and I'll go up to him and ask him which one do he want, which one he'll prefer.
I
So-
love that. So you give him choices, right? And what I love about that is, and think about it, what Seamus taught you, how to give him choices.
Like, can you-
To
Yeah.
communicate with them.
Yeah, through his behavior, he taught you that it's better if you give me choices, right? And so I love that you honored that, because that is so important that we honor his appropriate communication. Because it's when he's struggling to communicate appropriately and in ways that are interfering engaging in behaviors that are interfering and possibly dangerous, that's when we struggle. So the more we allow him to see that his appropriate communication is going to get him what he wants, the better off we are. That's wonderful. So in thinking about this again, back to the why, what I like to think about, a colleague of mine used this term first, and I just sort of took it on, is I really like to think about ourselves as behavioral detectives. I've been direct support professional. I don't even remember what the title was back 30 years ago, but it and I know the people who know him best are the people who work with him every day. So that's why have to be the behavioral detectives, right? I can help interpret the behavior, but you guys are the behavioral detectives. And that's what I want us to one of the big things I want us to come away from here with is that when we're thinking about what is happening in the environment, we're always thinking about the why. Why is this happening? And why is it happening with behavior we want to see? Like when he gives you choices, we know because he's learned to trust that you'll honor his choices. And behavior that we don't want to see. Why is this happening? Because the more we can get to the root of why, the better off we're going to be in terms of refining and developing new interventions. So we already talked about this, that when your hypothesis of why is based on the principles of behavioral learning, our intervention is really developed based on the assessment is much more likely to be successful than best guess. So I'm going to go back a little bit to the consequence thing. So the consequence, just as an example, it doesn't mean bad. We already went through that. But if I pick up a pencil or a pen, I can write. Consequence to saying hi to somebody, generally, most often, what happens?
Let's speak back.
They say hi back, right? What happens when someone doesn't say hi back to you?
My feelings are hurt.
Oh, exactly, exactly. Will you keep saying hi to them? No, exactly. You'll be like, although I do sometimes get the answer to that question. Oh, I will. I
To
will.
bother
Just
them.
to bother them. Exactly. That's like the common answer I get from somebody usually. But no, I mean the consequence is simply what happens after. If somebody saying hi back to you is the reason why, that's the reinforcer. It's what we call it. That's the reason why you keep saying hi to them. It's a social norm. It's something we learned when we were younger, probably, hi. But we wouldn't keep doing it if people didn't say hi back. That's the consequence that keeps the behavior going. And the other thing that we know about behavior is that it's reciprocal. So one of the things that I hate is, I dislike, is when we focus so much on the person's behavior, like Seamus's behavior, for example, and not on our own and what's going on with ourselves, because we are human and we're in the environment too. And we have emotions and feelings that come along with this, right? So just a simple example is the kid in the grocery store who throws a tantrum. They throw a tantrum because they want a piece of candy. And what as what is the most what would you say should the parent give them the piece of candy?
I don't reward bad behavior.
You don't want to reward bad behavior. Exactly, right? Like we know intellectually, I know intellectually that that's not the right thing to do. But you put me in that situation in the grocery store with everybody looking at me and my kid laid out on the floor, which it's happened. And I may be giving my daughter that she doesn't do it anymore. She's almost 18, but I might be giving her that candy to get her out of that store as quickly as possible. And a lot of times what we have to do is to make the decision in the moment. Is even though I know that this is probably not the right thing to do, is it safer to get the person out and then think about another way to approach the situation more positively or effectively? And so the other thing that I really think is important to keep in mind here is how the parent is feeling. And we often forget that, or how the caregiver is feeling, or how the staff or the teacher, whoever. I mean, there's a whole thing going on with them too, with us when we're in those situations that we have to think about why all of our behavior occurs for a reason too. I I make tons of mistakes, and sometimes I even know when I'm making the mistake. And sometimes it's because I feel uncomfortable or I'm not, so we have to keep in mind that behavior is interactive. It's not just about the person's behavior and it's not just about our behavior. It's about how they interact. And we do things because we're human. And so I talk about this very purposefully because when we're thinking about behavior, I really want us to understand that that there are two people in that room. We're going to make mistakes. We're human, and that it's really about the interaction. And when I talk about what we're doing and what we're not doing, I really want to set the stage. I want you guys to know that I am not ever saying anything in a blameful way. I really want to say that right up front because what the way that I'm approaching the way I approach all of this is that you have a really hard job. And even if I say something like, well, we shouldn't do this, or we should, oh, I hate the word shouldn't, I'm not even gonna go there. But I want you to know that I'm not, even if I ever give you like coaching or something when I'm there, it is not about right and wrong or any, it's about just us working together because I know that we all have our own things that we're dealing with in all of these situations. And so we have to keep all of that in mind. And I just want to make sure that we talk about that.
If I could just
Yeah,
share,
please.
going back to that. So prior to Seamus living at Parker, I have picked up shifts with him before and have taken him to Wegmans, which can be successful and cannot be successful. And at the beginning, I would tell him, okay, if we get through Wegmans, I will get you a chocolate chip cookie at the end. So kind of like setting expectations, like you're gonna get something. And I would not go by the bakery, like the bakery pastry section, but then they have like end caps and different things throughout the store.
Yes, they do. They try to get you.
You know, and there was the chocolate chipper, like big containers. And Seamus saw it and he's like, cookie. And I was like, yeah, those aren't free. Those aren't for you. You know what you're gonna get. And he like grabbed it and was trying to open it. And I was like, do I grab this from him?
Right.
And be like, if you can't get it together for me, you're not getting cookies. Or do I let him open the damn container and eat 15 cookies? Because then hopefully he'll be in a food coma and we can like get through the Wegmans trip. So it's like, I definitely have been there. And not like probably, I let him eat whatever he wanted out of that container because it was busy. It was a Sunday morning. Amherst Street Wegmans is like cray cray on Sunday mornings. So like you think you have it and you're like, okay, this is gonna go smooth. He knows we did it a bunch of times. He was really successful. Then you have something and he's so smart. He knows. He's like, oh, that's the jackpot.
And
And
he knows you can't take that from him in that moment.
yeah,
He knows. So that, I mean, that's such a good example, and we'll get to intervention. I'm not sure how deep into intervention we're gonna really even be able to get to today, but we will get to intervention. And one of the things that that I think about with a situation like that is instructive. It's not, it happened, things happen. Okay, so there are multiple things there that we might try differently. One is we'll talk about social scripts where we can actually go through an entire, this is what it's going to look like in the store. And he can even hold it or have it, or you can. So that's one thing we can do with him. The other is that we know that those end caps are there now. We hadn't thought about it before. There they are. We could have a problem. We can even add that to the social script. We can body position as we're getting closer to them. So one of the things I think about is sort of walking on the side of the end cap, that kind of thing. But we can plan for those proactively. In the moment, safety was the most important thing, right? In the moment.
yeah, I guess like the thing I struggled with is I was trying to prevent, like when I took him out Sundays, like I was trying to make sure we had success at Wegmans by like doing this special thing for him.
Mhm.
And then he got smart. He
Mhm.
realized I don't have to wait till the end all the time. And then it was a lot of guilt because I was like, did I set other people? Like, I wonder when he goes to Wegmans with other people, is he doing the same thing? So I think about like the tantrum, like where was it started with me? Was it started before me? And like those kinds of things. And you end up giving them the candy or
Yep.
20 chocolate chip
Yeah.
cookies.
So this is where communication among all of us is really critical, because my first thought when you talked about the cookie was that was that part of a plan for him, a written plan. And if not, he might start to expect that cookie from everybody.
Oh, yeah,
time he
it
goes to
definitely
Wegmans.
wasn't
Oh, yeah.
written
Yeah.
in
Yeah.
a plan, but I think everyone kind of had their way of like
Well, and
taking him out.
right, and so, but he says, I get the cookie with you. I should be getting the cookie with you, right? So you've already got that going potentially because we're doing things differently. And then you're taking him on a time when it was busy. You said that it was busy. So maybe so again, it's not about that one incident. That one thing happened, it happened. Those are things like that are gonna happen. We're gonna do our best not to make them happen, but from the perspective of thinking about behavior, we can see all of the things that led up to that, and we can see the things that would maintain that. So the one of the most common reactions is, okay, we're not gonna take him to Wegmans anymore. But the problem is with that is then we're not teaching him a better way to get through Wegmans, right? So what we have to do, and we'll talk about intervention, is figure out how do we teach him to get through Wegmans without that happening, and can we? And we'll talk about his repetitive and rigid behavior. Can we use his repetitive and rigid behavior and his history of learning skills for good to help him with those things? And we'll talk about that. We'll get to it. The other thing I really want to just hit on is that a lot of times when I start to work with people, they want certain behaviors to go away, but it's really not about behavior suppression. It's just going to pop up somewhere else. It's about teaching the new skills. If we don't teach the new skills, if we don't teach them how to get through Wegmans without diving for the cookies, then he's gonna know that when I go into any store and I see a bin of cookies, I'm gonna dive for the cookies, right? So it's not just about getting rid of the behavior, it's also about teaching new skills. So he can say, no, I really want that cookie. And then the question would be is that if he communicated it appropriately, would that be okay? So again, all things to talk about. And I do want to just emphasize that Seamus and all of us have, well, I shouldn't say all, I don't know everybody's history. Most people have lots of stuff that, as a colleague of mine recently said, is in their wagon. Things that they've experienced that have been that have been stressful, problematic, trauma. I know you guys have had training on trauma. And Seamus is no different. There's a whole, I'm not going to list all of the things, but I've gotten a pretty good sense of the things that he's had happen in his life that were pretty traumatic. And so I want to make sure that you know that I'm not ignoring those things when we're talking about this. We're just focusing right now on the environment, not the history, except for what he's already learned that can help us. So whenever we're doing this kind of work, we have to rule out medical. I'm not going to spend any time on this either, but I just, a lot of times I'll ask questions that relate to medical whenever somebody says somebody's struggling. My first question is often about what's changed, what's new, and really going to medical, because a lot of times people with disabilities in general and we'll actually talk about this at the training next Friday. A lot of people, their medical needs get overlooked. But we're again coming back to this function and the functional assessment, and why does the person engage in the behaviors? So this is where the ABCs come in. We've already talked a lot about antecedent behavior consequence. So essentially, if you look at any of my notes, you're going to see all of my notes that have ABCs. Anytime I've come to sit and watch, which I think is once that I actually sat and watched, maybe twice. Yeah, I'm writing ABCs. I'm just writing ABCs. This is where we get to how my brain works, because I am looking at what happens before and after every behavior, not just behaviors that we think are quote unquote bad, but every behavior, because they can all give me a clue about why Seamus does what he does. And this is really how we understand interfering behavior, is these ABCs. And they also, we know that, like when I said that when I was there with Jeremy, I was able to say things differently to him. Why do you think that is?
Because he's comfortable with,
He's comfortable with him. Why else? Any other? That's definitely one of them.
Would it be in two people in the room?
Two people, that absolutely could make a difference. Yeah. Any other thoughts about why I could change what I said to him when Jeremy was there?
I think probably because before you did that, Jeremy was doing something to help regulate him in a way where he might have had more distress tolerance
Maybe.
than.
That absolutely could be. Another reason could be that he has a long history with Jeremy, and Jeremy has spent a long time with him, teaching him different ways of responding, and over time has not responded the way that he expects us to all respond, right? So when Jeremy's not there and he says to me, say it, or whatever he's saying to get me to say it, and I don't say it, he starts to get anxious. When Jeremy is there, and if I say something a little different, he's much less anxious. He's much less visibly anxious. And it's all of those reasons. It could be any one of those reasons. And that's what I mean by context matters. We all behave differently in certain situations. And so in the store with you, it might have been, well, I know that she's not going to be able to stop me from getting the cookies. I don't know that for sure. I'm just making that up.
Oh, I'm sure he has a pretty good reason.
And the store with Jeremy, it's that in the past he's been able to stop me. So so I know not to go for them, right? So it's really about context a lot of times as well. So
I don't know if it still is at play, but like historically, he's been more patient with like newer people too, when they're like getting to know him.
Yeah.
He's been more patient. He gets really excited. You're just learning him and he knows that. So he So it's almost like, I don't know, he's almost shaping you.
Oh, he does.
Yeah.
He shaped your
Yeah.
behavior with the
But
choices.
but also I feel like now it's
Recently, yeah, it's like the
it
opposite.
hasn't been, and I feel like more so now it's more male dominant. He's not like he doesn't.
So historically speaking.
Yeah, right.
Okay.
Well, and but before, like I feel like it was historically he wasn't about like males. That was kind of
Yeah.
like that's who he is. But then he was. I feel like when he was at Colvin, he was okay with being around males. He was just like, okay, well, like work with me. That was like his response. Now,
You can tell that he's learned, like, oh, you're new.
right?
Repeat after me all day, yeah.
Yeah, right.
He
See,
knows.
Right.
With me, the whole cover thing, I only started giving him the option because of pretty much what she went through. They'll snatch the cover off.
And
Yeah.
it
And
makes
then-
you just think,
You read his
yeah,
behavior.
yeah, give him a choice. What we
You,
supposed to
you read his behavior. I have to say, one of the things that I think I think I've said multiple times, is I don't ever leave his apartment without saying how kind and caring you guys are. Like it's really clear to me that you care about his well-being and about how he's doing. And the only reason why I think that, not the only, but the biggest reason why I think that that you would watch these things and make those decisions is because you want him to do okay, right? Like you want him to be okay. There's also the eggshell effect. So you also don't want him to not be okay, right? So it's this combination, like think about how you're feeling, that interaction, right? He's teaching you to help him express himself. That's wonderful. He's also teaching you that if you don't say what he wants you to say, you might engage in challenging behavior. So in all of those ways, he's really shaping your behavior, right? And that's, I mean, that's how he's telling you what I need and what I want. And so again, we want him to be okay with not always having somebody say exactly what he wants to hear, because that's not the way it's going to work in the real world. And we're going to make mistakes. We can't spend all day, every day saying to him exactly what he wants to hear, because we're going to make a mistake. We're human. And sometime I'm not going to say the right thing. So the other thing that I just try to remind folks, but I think I really think from you guys talking about this, and please keep jumping in, is that it's really hard not to take this personally. I've been doing this a long time, and I don't think there's anything personal about some of the things that he does. I think it is truly that there is something so much that he struggles with internally that we don't understand, that that he can't almost help himself. So really that's where we come in to try to help him figure out how, and to figure out how to help him help himself so that he doesn't do those things. So I circled this. There's 4 reasons why people do what they do. I circled automatic and sensory because that's the one we're going to focus on. But I'm going to go through all of the reasons because you also talked about what we would call access. So we'll talk about that. So one of the reasons why people do what they do, one of the functions of behavior, is that access to preferred items. So did someone just take an item away, or did a preferred activity just end? Is that when you see? Those are the questions that I ask you, right? Like, what do I have to do to see the behavior? Did someone take away my food, or did someone deny me food, right? That's access to preferred items. Does the person get the item back? Was the person told there would be a delay, that they had to wait for something? Those are all reasons why sometimes we see behavior. And the way we know if that the function is tangible or access is, does it stop? Does the behavior stop when they get back what they, or they get the thing that they wanted? Sometimes, right? So sometimes it's probably access, because it's almost like that light bulb moment. And this is where the behavioral detective comes in. So when you watch the things that he does and the interactions that you have with him, it's almost like the light bulb, like, oh, okay, this is what stops the behavior. Okay, that means that the function is probably tangible because he's engaging in the behavior to get the things that he wants. The other one is attention. attention comes in many forms. It comes in, it comes in hugs, and it comes in talking, and it comes in playing games with people. So when I use the word attention, I'm talking very broadly, that getting some type of attention from somebody. Is the person doing this to get attention? A lot of times people think that people are, because attention happens all the time. But a lot of times it's really not true. So it's really important to watch the patterns of behavior. Does it stop when they get the attention? If the behavior stops when they get the attention, then it might be attention.
And I will just to interrupt and touch on that attention.
Yeah, please.
Learning Seamus over this time, his does vary from different things, access or attention. Sometimes when I am repeating him, he just want to engage in the conversation. So it's just like repeating, he's enjoying me repeating it, and we're just talking about going to the airport tomorrow.
He loves it.
Mhm.
Yeah, he loves it. So I'm gonna wonder if that is as much about it. It's hard to tease that one apart because it's attention, but is it also something that he needs to hear internally, right? So that one's a tough one. And then the next one is escape. Does the person engage in the behavior because they don't want to do what they're being asked to do? Does the person engage in the behavior because they don't like the person who's asking them and they want to avoid them? Does the person, this is all about escaping something we don't like. And a lot of behavior is about escaping. A lot of all of our behavior is about escaping things we don't like. I talk about this a lot. I do a lot of work to avoid somebody getting mad at me. Escaping, right? I mean, I'm doing a lot. I'm not doing it happily, but I'm doing it because I don't want to get in trouble, right? That's escape. So escape can be a lot of things. But we're focusing on the automatic and sensory. That's what happens underneath the skin. Behavior is reinforced by the behavior itself. And I like to think about this as, we all have our own little idiosyncrasies. And one of the things that I think about, one of the easiest examples I have to use is does anybody know someone who plays basketball? Who's really good at basketball? I'm a KU Jayhawk fan, so that's why I always use basketball. When somebody is learning to make a basket, particularly something like a free throw, it's pretty stressful being on that free throw line, right? When somebody's learning, they may shoot the ball over and over and over again until they hear just the right sound of the swoosh of the ball going through the hoop, right? What is the reinforcer? It's that swoosh. Would I know? Do I control that swoosh? No, it's the person who's shooting the basketball. The reinforcer is internal to them. I think about the same thing with people who practice instruments. They practice and practice and practice until it sounds just right to them. And it may have sounded perfect to all of us before that, but they have something they're listening for. That's what we're talking about with Seamus. It is something that is so important to him internally to hear, that he's waiting to hear exactly what it is that's important for him to hear. That's an automatic or sensory function. And that's one of the hallmarks of autism.
That for sure is Seamus, because I know what he's going to say. A lot of times he kind of shortens his phrases for me. So I know exactly what he's going to say, so I can say the long phrase.
Like he's gotten his behavior down to the minimal effort.
Like for me, he's like, well, he says like plane fast. I'm like, oh yeah, the plane is fast. Like, what are you gonna see it? Are you gonna sit in the window seat? And it's like this whole back and forth, and he knows that. But then also if he says like snack today, I'm like snack every day, and he says Kira, and I'm like, I say it before he says it, and then like he puts the biggest smile on his face because it serves a purpose. Like he's like, oh, I know exactly you're gonna say exactly how, like. Say it exactly exactly how I want to say it. Also, like sometimes my cadence is the same as his too. So he's always like, oh, yep, there it is.
That's important to him too.
Yeah.
The reasons why, so there's some things with that, right? It's a lot of times it's fun to engage with Seamus that way. It also is something we know he likes. So he's happy when he does, when we.
He'll bob, like
Yeah.
he'll do his head thing.
It
he'll do
makes
this
him happy.
hand
There's
sign.
something
Yeah.
about it. And a big part of it could be just that he likes to interact with other people, and that's the way he knows how to do it. The reason why we know that it's also automatic or sensory is because he will get upset if he doesn't get it. And the kind of upset he gets, it's emotional, right? It's like you can see it's emotional. Like I've watched him. It's like that's how we know that it's more than just that he likes to interact with people. That it is something that's so important to him internally that he can't not do it. And so that's why focusing on how we intervene for those things is so important in a safe way. So what we're talking about here is what's called reinforcement. It's basic principle behavior. It's why we do what we do. We're using function-based thinking. So we're wondering why somebody does what they do. Basically behavior happens, something happens after it, and then the consequences, the behavior is more likely to happen in the future. So if something, we like the way something felt or the way we liked some, then we'll do it again because we want to get that again, right? If I was successful in getting somebody to leave me alone that I didn't want around me, I'm going to do it again because it worked, right? So I always think about I can be pretty loud, and I was in the hallway with one of my colleagues. I was talking very loud, and they slammed the door, and so I was like, I guess they're communicating. I'm speaking too loud, and after that I stopped doing it. Right, it worked for him. It's as simple as opening up our umbrella to get rid of the rain, right? That's a reinforcer. We'll do it again because the rain goes away. It's things like, why do teachers call on kids who raise their hand? They raise their hand, the kid gets called on. What's going to happen the next time the kid wants to get called on? So that's how we shape up behavior, right? That's how Seamus has shaped up our behavior too. It's because it feels good. It feels good for us. It feels good for him. We're going to keep doing it, right? We're avoiding the problem. We're also helping him communicate. All good things. A person wants to watch their favorite TV show. The roommate says no. The person screams and throws the remote. The roommate puts on the TV show. The person stops and watches the show. The behavior was throwing the remote. The consequence was
Shut
show got put back on. So what's gonna happen the next time they want that somebody says no, you can't watch a show? Throw the remote. Throw the remote, right? Exactly. Again, this is all how we learn things. I'm not going to spend too much time talking about positive and negative reinforcement. It's because it can be a little complicated, but positive reinforcement just means that something happens that we like. And some examples is, putting money card in the slot machine and money comes out. That's always good, right? Pushing the button on a vending machine and something comes out. And then there's negative reinforcement. And the only thing I want you to come away from this with related to negative reinforcement is that it just doesn't mean bad. A lot of times negative reinforcement, all it means is that we're taking something away. It's like a math problem, negative, removing something we don't like, right? And so that's what motivates most of our behavior in real life. Most of the time we're doing a lot of things to avoid, like I always use the example of my mom. I learned a long time ago that if I don't call my mom 1 to 2 times a week, I am never going to hear the end of it. So the way to get her to stop is I call her 1 to 2 times a week. I call her the master of negative reinforcement. Like she's got my behavior on such good control because she'll make my life miserable if I don't call her, right? So that's negative reinforcement. We see this a lot with people we work with when they run away from places because they're too crowded, so it's too much for them, or it's too noisy, so it's too much for them, or they just can't deal with something. And so we see that all the time. And we already talked about the tantrum, so I'm not going to go there. But we're going to talk about extinction because this is the thing that I mentioned when real life happens. So real life happens when we take away a reinforcer. So by accident, one day we weren't able to tell Seamus exactly what he wanted to hear. What's going to happen? Or we didn't know exactly what he wanted to hear. What's going to happen? Behavior. We're going to see a problem, right? That's extinction. We're not implementing it on purpose. We're not trying to stop telling him what he wants to hear, but we're human. And today we didn't, or we're human and we got tired and we didn't want to say it again. And we didn't want to say it again, right? All of these things happen in real life. And that's what's called extinction, because right now, as far as Seamus is concerned, if I want to hear what I want to hear, I'm going to say the repeated phrases, and you were going to tell me. And he's got us all shaped up to do it. And that's how his life is running right now. At least that's my observation. Please tell me if I'm off base here, because you guys know him better than I do. Way better. So,
And I guess,
oh,
and I feel he is a lot better about not hearing it as it should be said, especially because I've noticed that he is working with like newer staff. Like, so they're still trying to figure him out. So he's not necessarily like that upset when it like when
that's good.
So and then but like, and I know for me, and I guess maybe because I know him for so long, that there are times that I can tell him like, hey buddy, like I have to focus and do this thing.
So he listens.
And it's not for long. Right? Like
Not for long.
Right. He's very like I might get maybe 3 to 5 minutes out of it. Maybe if he's in a good mood.
I only seen that with Jeremy.
Right.
Successfully.
Mm-hmm.
Jeremy.
Yeah.
So then you have to ask yourself, why are you even able to get 3 to 5 minutes? That's really good.
They're really keeping on staff.
Yeah. So what is it? What's the difference? Is it history? Is it how you asked him? Those are the kinds of things I want you to be the behavioral detectives.
So what I can say for me, and because I think I'm not sure who I told this to, and I was like, he has like, as far as like my response, sometimes I have to stop myself, like, because sometimes he's not necessarily looking for a response. He's not necessarily saying, tell me, but he's just saying it. And because I hear it automatically, I repeat it. Now he's like, oh, okay. So you repeat it. Let me say something else. So I also have to train myself not to say anything, because there's times I'm like, oh, hey, buddy, like, give me a minute. I'm going to do this thing. And I go to do it. And then in the background, he's like, grandma's house tomorrow. And I'm like, oh, in Florida? I'm like, damn it. I told you. Just don't give me a minute.
Yeah.
Yeah.
Oh, so you're getting at the crux of the things that we need to be thinking about is how are we going to extend his ability to not hear what it is that he seems to want to hear as one of the things that we want to work on, right? There's a whole bunch of stuff, but what we know is that these behaviors are often a reaction to stress or anxiety as well, and they cause stress and anxiety. And so what we want is for him to have a much less stressful and anxious life, right? And so we've been talking already. We've done some of the talking that I wanted to do about the things that you're seeing, and we only have about 12 minutes left. So I do want to move on to the some of the interventions. But what I really want is if you guys are willing is for you to start thinking about behavior from this perspective with Shane. Like, oh, okay, this is what I know if I do this, we're going to see this. And, oh, okay, this is what he seems to be looking for, to see if there's things that we're missing, right? Because right now we're talking about a lot of things based on, a very quick conversation, but you guys have lots more experience with him. So if you can think about things from that ABC perspective, the more communication about the things you're seeing, the better. With me, I don't know if there's a way to document those things, if we can have like a notebook or something, but if, like I said, if you see my notes, it is literally ABC, and I'm writing them like all out, like this is what happened before, this is what happened after, and then I analyze the patterns. And so that's what, if the more we get those kinds of data, those kind of information, not in the moment, because in the moment you're dealing with this issue, right? But after, like when you're thinking about it, the better. So we've already talked about this walking on the eggshell effect. And one other thing I want to mention is to know your own triggers. I have been doing this a long time. I've had unfortunate things happen in terms of, being aggressed upon, et cetera, et cetera. I know one of my triggers is being spit on. Like, I really struggle when I'm spit on. I know that, another trigger for me is when I'm bringing a whole bunch of stuff that just happened at home into the, like, it's important to know our own triggers because that's going to lower our threshold of being able to do any of this work. So that's when we have to rely on each other and get support, but also it's being accepting and understanding that we're human and we're going to have those it's real life, right? So it's just really important to be aware, I think. So there's some basic interventions for repetitive behavior that we're going to focus on because they've been successful for Seamus. He has a long history of learning these things, and we're going to take advantage of that long history because when I sat down with him, with Jeremy, to do a bin thing with him, and it took him all of like 2 minutes to go back to doing it the quote unquote right way, the way he learned at Kennedy Krieger, because he knows it. He knows it. He knows it. We just have to use that as an opportunity. That calms the heck out of it, right? We want to use things as much as I don't want Seamus to be doing bins all day long every day. I want him. I mean, he needs to go out. He needs to do all these things. One thing about the bins is that they help calm him. And so it's important that, that's a part of his day. So we're going to really focus. Oh, yeah.
So there are some times where he becomes hyper focused on the bins, and it's not necessarily a calming thing where we kind of like try to have to get him out of it, or because he wants to work for yogurt, we become.
Oh, it's the yogurt.
Right, it's the yogurt, right? That like because he's like, oh, work for yogurt, so I'm gonna just keep doing these bins to keep getting the yogurt.
Immediately yogurt because the
Mhm.
first times that I met him, I did the bins with him with the yogurt, and so I'm the cue for the yogurt now too. So like I get it, yeah. Yeah, no, you're right, and that's where these schedules come in. So one of the things with autism, we talked about the rigid and repetitive behavior. Seamus has a long history of learning how to do things rigidly with schedules, with the picture schedules. It seems like a really simple thing, and it may not be the be all and end all intervention, but it's a start. One of the things I didn't say is that one of the things I often talk about with intervention is I would rather us be all doing the same exact thing, even if it's not the right thing, like even if it turns out to be the wrong thing, but us doing all the same thing, because then we can figure out, was that right or wrong? Like, did that work or did that not work? But if we're all doing, like when you talked about the grocery store, right? And everybody has their own way of doing something. When we have our own, not that we want to, there's some creativity in there and human interaction, but if we're implementing things, everybody's implementing things differently and interacting with them differently, then it's really hard to figure out, okay, what is it that's really working and what's not working? So we're going to start with the schedule. And what I hope the schedule helps are things like you talked about with getting him out of something. Because if you think about this rigid behavior, if we write down or have pictures for him of things that he is supposed to do, one of the things with autism that might, for him, because of his history, that might happen is that he becomes focused on this schedule.
I've seen it. He does.
Yeah.
Yeah.
Yeah. So
His schedule, staff schedule,
yeah,
any type of schedule.
yeah.
So
let's
know who's coming. Like,
let's use that to his advantage and our advantage. So if we have a schedule and we start out, let's say, wake up, breakfast, independent bins. One of the reasons why Jeremy went through and redid all of the colors of the bins is we wanted independent and interactive bins, because as a staff, I mean, I've seen how hard it is. I know how hard it is when you have things to do, like cut up his food, and he's over there doing something that, you need to, and he's calling. So we wanted to have things like we wanted to be clear what were independent bins, because during those times he should be doing that independently. We'll talk about things like setting a timer.
so that he knows that you can say to him when the timer goes off, because he gets all of that. His history, this is all things he knows. I
Are we
also,
still using a timer for his spins?
Yes, we still, well, most people are.
Yeah,
it's,
we do need a few more though.
yeah.
Yeah, and some batteries.
He's also missing a token, at least the last time I
Always
checked.
missing a token.
There's some I can.
So I also at some point want to get to how we're using the tokens, because that's a whole other thing. But we can talk about that. But what I'm hoping is that, let's say he's on independent bins on his schedule, and you're struggling with getting him off of independent bins, you can blame the schedule. It's not you who's trying to get him off of the independent bins. I love having something else to blame. Look, the schedule says walk to Delaware Park. Okay, so that's what we're doing. We're gonna walk to, is that gonna work 100% of the time? No. But if we are all doing it and we are getting him to focus on this as his rigid behavior versus some of the other things that he's focusing on, then we can start to see that change, right? The other thing that I'm hopeful about is that if these things, like, let's say they're Velcro, right? So you can make a schedule with him. If they're Velcro and he's really starting to escalate, you can take the schedule and slap on it something that's a coping skill, like getting in the shower. So you could say, oh, look, your schedule changed, it's shower time. Or, oh, look, let's say it's still bin time, but he's struggling to with the bins. Oh, look, it's snack time. Oh, look, you can change the schedule. And this gives you the way to change things with him that are going to be much more acceptable, hopefully. Again, I use the words hopefully. I know this is a lot, but these are things that he has such a long history with, and he has rigid behavior. So we're hoping that these things that have been successful in the past will help us to make one major change in what we're doing with him. Just one major change. It's major, but one. And then once we do that, we can do other things. Like one of the things that we talked about is that I watched him have real problems with his meal recently. And he took it, shoved it in his mouth, and I couldn't stop him. And one of the things that we can do is we can take even things like a mealtime and break them into smaller schedules. So they could actually say 2 bites, take a drink, use your napkin. So he's following the schedule with the eating as well. So again, is that going to stop him? Not necessarily. I know that especially from your perspective, I don't want to put words in your mouth. I'd be sitting there like, okay, right. I am really hopeful because he is so smart and he's had such a long history of these things being successful with him, that if we put it in place with consistency, that it might actually be a first step, not a, we're not going to see like new Seamus, but a first step that we can then take and use to do other things with him. So, and I can't even tell you how sorry I am that we are like at the end of time. But I'm curious what your thoughts are. I've talked at you a lot.
I mean, I believe it works. And I say that because it's like on a restaurant, when you have multiple chefs, if everybody not using the same recipe, that one meal might not come out consistent. So everybody's on the same page, same recipe, we will work.
And
And especially the schedule how Seamus is very routine. He loves his routine.
He loves it. And I'll be honest, one of the things that always frustrated me the most is if I was the person getting hit because other people weren't following something that should be followed. So it's really on us to also encourage each other to be as consistent as possible. Because I know, that's all we can do is to, really help each other. And I've observed really cool teaching of new staff the few times I've been there. And I know you guys really care about that. So that's been wonderful. Sorry, I don't mean to just, I want to really hear what you have to say. I'm sorry. I have a hard time not talking. That's one of my problems.
Nothing really, just hoping that, to see some success from it would be nice, so, cause you can tell right now without the plan of something in place, it's like a little bit mixed up and confusing also for Shaman, so we're glad to see.
I'm glad you said that, because I think that it is confusing for him. That's my guess.
I'm still learning him, and I know he's still learning me, so.
It's gonna take time.
You're actually starting at a good time then, because we'll hopefully shape up good behaviors, right?
I think someone who has known him for a pretty decent amount of time, we've done schedules like at day program. And when he was at day program, he had a visual schedule, but he didn't have it at home. Or like he had an activity like where it was like an outing type that like it hasn't been across the board where we could use it for like meal times or doctor's appointments or, you know, what have you. So I think it's like, this is an intervention or a tool that's going to be used throughout like his day to day, not just like here and there. I think he's actually going to take comfort in that. Because there's been a lot of visual schedules with him.
Sorry.
I don't know. I just
Because yes, you're right. Yeah, no.
Ashley and I know each other. That's why I like looking at her.
Got it.
But
Yeah.
she, like, it's been tried so many times and it's just,
The consistency of it.
You know, one of the things might be that sometimes it's about timing too. I mean, it might be about the group of people we have in the room now. And
And I also think his environment is different than when we were trying to implement things before. Like, so this is a different environment, right?
yeah, it was banana sandwiches, like,
Oh, yeah.
before.
yeah, and I know that's probably some of what's contributed to, you know, his struggle, but also yours and, you know, so yeah, I mean, maybe it's about timing. Sometimes that's it. And hopefully it's a place to start. It's not our end, but it's a place to start. I will be there next week. What I'm hoping to do is to coach, and I mean that sincerely by using the word coach. Like my role is to help. So so when we introduce the schedule to help with how it gets implemented, to help you guys with any questions, to show you how we're doing it, because really the only way that I think that I've seen being successful is if we have a lot of support and support each other, because this is the big, for lack of a better term, it's a big lift. I don't know what it's a word that I hear a lot. It's a lot. I know it's a lot, but hopefully with some support, you'll feel like it's not as big a lift. So so I'm gonna try and go, I think on next Tuesday, and we'll just introduce it. We're just gonna introduce it and see how it goes.
Sound like a good idea.
Thank you. Thank you guys so much for being here. Appreciate it.
We should have more people, but we'll be glad
That's
to
okay.
have you at the sites and get to meet some of the people there.
All right. Yes, oh my God, he's texted me multiple times.
You out of here, Marquis?
Yes.